So to begin our practice, please come into a comfortable lying position. Supporting your legs well with a bolster or pillow so that your low back can relax in a neutral position. Taking support for under your neck is needed as well, so the neck and shoulders can also be completely relaxed. Allow the arms to stretch out to the side, palms up. And please bring your attention to the breath. Specifically focusing on the exhalation breath, begin to engage the lower abdominal muscles from the pubic bone to the navel, all the way up to the lower rib cage, pressing the breath up and out of the body. And as you inhale, relaxing that action as you expand through the chest and the ribs and into the abdomen. Exhaling, drawing the belly in, pressing the breath up and out. Feel a gentle stretching on the lower back as you do that. Inhale and expand, chest to belly. Slow, deep exhalation, hugging the belly in, releasing the breath incrementally, keeping the neck, jaw, shoulders relaxed. Inhale, expand, chest to belly, feeling the low back curve naturally return. And once again, exhale, draw the belly in, and press the breath up and out. From here to transition, please bring your knees into your chest. Roll over onto your side and come up to stand on the knees. As you stand on the knees, please take the arms out to the side, drawing the shoulders down, shoulder blades drawn into the spine, abdominals slightly engaged to prevent overarching of the lower back. So you're drawing the belly in and neutralizing the curve in the lower back. Inhale, sweep the arms out wide, lifting the chest, and as you exhale, fold the arms back down to the low back, draw the hips down, and gently stretch into the back of the body. If you're unable to kneel due to knee and hip conditions, please use a chair. Placing your feet hip width apart. With your inhalation breath, sweep your arms out wide, palms up, reaching the arms high, extending the spine, and as you exhale, sweep the arms to the lower back as you fold forward, releasing the head, neck, and shoulders completely. Once again, inhaling, standing up on the knees, sweeping the arms out wide, keeping the neck and shoulders relaxed. Exhale, once again, engaging the belly as you fold down, hips move to the heels, and the arms gently fold to the lower back. Inhale, standing on the knees, full wide sweep of the arms, and exhale, arms fold back, upper body releases, neck releases. Inhale, standing fully on the knees, reach out through the fingertips, opening up through the heart center. Exhale, draw the arms down, draw the hips back, and fold all the way forward. From here, please come to lie on your belly. Placing your hands so that the palms are just outside the shoulders, forearms on the floor. We're going to work with a very strong movement that supports and strengthens all the muscles of the low back, the hips, and the pelvic girdle. With your inhalation breath, please lift your chest and lift both legs and straddle your legs wide. Keep your chin in so your neck isn't strained. Exhale, squeeze your thighs slowly together, and then come to rest down. Once again, inhale, lift the chest, lift the legs. Hold for a moment. Exhale, squeeze the thighs together. Feel the inner thighs working strongly. And then rest the upper and lower body back down to the floor. Inhale, lift and straddle wide. Keep the shoulders soft. Exhale, squeeze together. Draw the belly in a little to give us additional support. And rest down. And one more time. Inhale, lift. Feel the strength in your body. Exhale, squeeze and hold and release completely. And just take a moment here to feel the effect of that work on the back. And from here, coming onto your hands and knees, using your arms, your abdominals, and your legs to support you as you transition back up. Hands are placed below the shoulders, knees below the hips. With your inhalation breath, rotating the pelvis forward, drawing the shoulders down away from the ears, gently lifting the head. As you exhale, engage the abdominals, relax the head, neck, and shoulders, folding the elbows and drawing the hips all the way back to the heels. Feel the stretch on the lower back. Once again, inhale, come forward. Be easy with the head as you lift it so there's no tension in the neck as you come forward. Exhale, belly always coming in, upper body softening as you fold the hips back to the heels. If you're unable to come to a kneeling position on the floor, please use a chair. As you inhale, slightly tip the pelvis forward and come into a back bend. And as you exhale, draw the belly in, round the back, and let the hands slide down the legs, softening the shoulders, relaxing the head, neck, and shoulders. Inhale, roll the shoulders back as you lift the chest, coming into the back bend. And again, as you exhale, engage the belly, around the shoulders forward, allow the head to release, and slide the hands down the legs. One more time. Inhale, coming forward in the wheel pose. Exhale, stretching back, enjoying the feeling of length and release on the lower back. From here, please come into a lunge, bringing your right leg forward, taking a little extra padding for your left knee. And as you bring the right leg into the forward position, be sure that the shin is perpendicular, the knee directly over the heel. Bringing your awareness to your low back. Notice if you're tending to sink or sag into the lumbar spine, be sure to once again engage the abdominals. Do that little zip up action so that you're supporting your pelvic girdle well. From here, begin as you inhale to bring your left arm forward and up, creating a nice elongating stretch from the left knee through the fingertips. And as you exhale, bring the arm forward and down. If you are unable to kneel, please use a chair and a firm bolster. Seat yourself so that one buttock is on the chair and the other leg is free to stretch back over the bolster. Position your front leg so that the shin is perpendicular with the floor, and place your hands on the front knee for the start position. Engage your abdominals, supporting your lower back, and with your inhalation breath, raise the arm, stretching into the full length of that side of the body, and exhale and bring the arm back down to rest on the knee. Inhale, reach forward and up, keeping the neck comfortable so that you're not straining in any way. Exhale, release the arm. Each exhale is a reminder to do a little upward zip of the belly, supporting the lower back as you practice. Inhale, lengthening up through the left side, and then exhale, release the arm. And come once again to stand on the knees, taking a moment to feel the effects of that asymmetrical work on the one side before transitioning now to the second side. Left leg forward, positioning the left knee well, shin perpendicular, bringing the abdominals in to support the low back, and then with your inhalation breath, bringing the right arm forward and up, stretching into the whole right front side. Exhale, release the arm down. You may notice a difference between the two sides as you work this way. Inhale, bring the arm forward and up. None of us are exactly symmetrical in our structure, but working asymmetrically this way is a way of bringing more symmetry into our body. Inhale, lengthening all the way up through the fingertips. And then exhale, release the arm back down. And once more, come and stand on the knees. Take a moment here to just pause and feel. And now coming onto your back, opening your blanket out once again, and taking support for your neck as needed. As you position yourself, draw your shoulders down away from the ears. We're going to be working with some abdominal strengthening now. So first, just bring your knees into your chest and give a little gentle hug in. Now relax your arms to your side. Let the shoulders roll out. And we'll begin to work with knees to chest, but without the arms, so that the abdominals are doing the primary work. As you exhale, hug the knees in. And as you inhale, let the knees rock back just to about so the thighs are perpendicular to the floor. With your exhalation, draw the knees in, keep the neck, jaw, and shoulders relaxed. Inhale, the knees rock back. Keep the inner thighs very much engaged with one another. Don't let the legs splay apart. Exhale, draw in, feel the zipping up action of the belly. Inhale, the knees rock back. And one more time, exhale, draw the knees in, hug the belly in, hold for a moment, neck, jaw, and throat relaxed. And then inhale and release the feet to the floor. From here, we're going to stretch into the backs of the legs. So please bring your right knee into your chest, hands behind the back of the knee. With your inhalation breath, press the heel up to the ceiling and stretch all the way through the back side of the leg. As you exhale, fold the knee to your chest and repeat, please. Inhale and reach up through the heel, pointing the toes down, stretching into the calf, into the ankle. Exhale, draw the knee into the chest. And one more time. Inhale, stretch up through the back of the leg, hold for a moment. And then exhale, fold the knee into the chest and place your right foot to the floor. Transitioning to the left knee comes in, hands behind the back of the knee. Inhale, stretch up through the heel, noticing differences between the right side and left side as you stretch. Exhale, fold the knee to the chest. And once again, inhale, extend fully up, draw the toes down. And exhale, fold in. And one more time. With your in-breath, full stretch up through the back side of the leg. Pause for a moment. And then exhale and release and place the left foot to the floor. From here, please bring the soles of the feet together and allow the knees to drop apart, coming into butterfly pose. This pose is excellent for bringing circulation to the whole pelvic girdle and strengthening the inner thigh muscles, the outer thigh muscles, and the abdominals. With your exhalation breath, very slowly begin to draw the thighs together, draw the belly in, and once again flatten the low back towards the floor. As you inhale, opening the legs, feeling a symmetrical balance of work between the right side and the left. Exhale, draw the thighs together, draw the belly in, flattening the low back once again to the floor. Inhale and open. Keep the pace nice and slow. Lots of focus on the exhalation breath and movement. Inner thighs very active. Inhale and open. And one last round. Exhale slowly, zipper action in and up through the belly. Good. And from here, let the feet return to their natural position on the floor. You'll want to once again place support under the knees and lay yourself out for the relaxation position as we began the practice. Shoulders drawn down away from the ears, body completely comfortable, at rest. Bring your attention to the breath. Gentle awareness of the exhale and the connection between the exhalation and that zipper-like action of the abdominal, slow, easy out breath. Allow the whole back side of the body to feel as if it's completely resting, merging into the floor. Letting go of the back of the head, the neck,